Hamilton Public Health has confirmed a case of the measles in the city related to recent travel. This is in addition to the cases identified in Haldimand, Norfolk and Grand Erie. Danielle DeGraw joins us live in studio with more. Danielle.
Thanks, Kelly. We spoke to the Department of Public Health this afternoon. One confirmed case in Hamilton as of Friday, making it 2 cases they've managed so far this year.
Just this past Friday, Hamilton confirmed 1 travel-related case of measles, and Hamilton Public Health Services has managed 2 cases of measles in 2025 thus far.
Dr. Brendan Liu is the Associate Medical Officer of Health for the City of Hamilton. He emphasizes that while in Ontario, the standard dose of the measles vaccine is administered at 1 year and 4 years of age, and it is possible to have a child vaccinated between 6 to 11 months if traveling.
The part that I really want to emphasize for the parents and students and for the general public is that vaccination against measles is really the most effective intervention that we have in the community.
We need vaccination rates to be really, really high. So estimate is about 95% vaccine coverage to stop an outbreak from happening.
Jana Shapiro studies immunology at the University of Toronto. She says one of the reasons we are seeing a surge in measles cases is because we are currently below that 95% threshold.
When vaccine rates go down, and there's still measles in other places in the world, you're starting to make a breeding ground where if one case is imported into Canada, because vaccine rates are low, that case can spread.
Shapiro cites kids missing vaccine appointments during the pandemic when doctor visits and travel were restricted as one reason why we might be below that threshold. Also, the controversy surrounding vaccines at the time.
They're worried about the risks to their individual child, partly because, we don't see children dying of infectious disease very often anymore.
Catherine Carstairs is part of a team studying anti-vaccine rates in the 80s, 90s, and early 21st century. She says they've read many of the anti-vaccine books of the time and can see with all the potential risks listed why parents might be hesitant with the measles vaccine.
A lot of these are, would never come to pass. They are, very much exaggerated. But if you're a parent and you're reading this, I think it's quite understandable that you would feel concerned about the risks of the measles vaccine.
We reached out to the Ontario Ministry of Health today, and they say measles in Ontario has been rare due to our high vaccination rate and elimination of measles in Canada. They say we're seeing an increase in cases now from people traveling outside of Canada and bringing it back home.